Question of the day. I'm an out-of-network provider. Why is the insurance company auditing my records? Can they even do that? Okay, so this is a commonly asked question, and I know my answer is going to ruffle some feathers. A quick reminder, I am an advocate for clients, and I'm also a clinician, and I'm also a truth teller. So let's chat about this. Before we dive into this question, I want to take a moment and thank our sponsors and EHR of choice, TherapyNotes, for sponsoring this Q&A. So head on over to therapynotes.com and use our community code MIMH to try TherapyNotes for free for 3 months. All right, so let's get back to this question. So you may not have a contract that obligates you as the provider to abide by the insurance company's terms, but the moment your client submits a request for reimbursement for services rendered, the client activates their agreement with the insurance company. This is what opens your records to auditing. Okay, so let's kind of continue that conversation a little bit more. The insurance company has the right to determine whether services that were provided were rendered by an eligible healthcare provider, an eligible and valid healthcare provider, and they have the right to determine if the services were medically necessary. Remember, not all things are covered by insurance or eligible for reimbursement, and so this is part of what that audit does. The client seeking reimbursement opens their clinical file. Remember, ultimately, this is the patient's medical record that is being audited, the patient's medical information. So they have the right to release it to the insurance company or really whomever they choose. And not complying can result in the client being denied reimbursement. And so we really got to determine whether this does harm. And so keep this in mind when you're doing your clinical documentation. This matters. Additionally, auditing at its core was established to mitigate insurance fraud. This is also why a health insurance company might request an out-of-network provider to furnish their NPI and their W-9 information. Again, it goes back to validating that a valid healthcare provider was involved in the rendering of services. And so that answers that question about auditing. That's what opens it up. I want to also add that a client can choose to not seek reimbursement. We cannot provide undue influence and then opting out of not seeking reimbursement because we're trying to prevent an audit. So I just want to make sure we're acting in ways that are ethically compliant. So if you're not in our Facebook community, join us in Mastering Insurance for Mental Health Professionals. Also follow our business page under the same name, where we post daily tips and resources and can continue this conversation over in the community. So feel free to join us. I hope this was helpful, and I'll talk to you next time.